Welcome back to another episode of Living with FASD, an informational, educational, human interest show for those with fetal alcohol spectrum disorder, their loved ones, or anyone else just wanting to learn more about FASD, brought to you by someone with living as well as professional experience. So, this is part two of a two-part series with Dr. Jerrod Brown talking about sleep issues. Why do so many people with FASD have sleep issues? And in the previous episode, if you didn't listen to it, go back and listen, give it a listen. There are just so many different ways that the prenatal exposure to alcohol can tee us up for poor sleep. And so in this episode, we're going to be talking about what can we do about it so that we can have restorative sleep, right? Not the tossing and turning all night kind of sleep, but the world stops and you wake up refreshed kind of sleep. That's what we all hope for. Life is so much better on those mornings, right? So without further ado, Dr. Jerrod Brown, thank you again for your time,
Absolutely.
especially for doing a two-part episode. So yeah, let's talk about interventions. What can we do to help?
Well, thanks for having me back. And the frontline intervention to start with is getting a good screening process in place to know what we're dealing with. So working
Okay.
with your healthcare provider, but in some cases, it may be, as you mentioned in the last episode, a sensory evaluation. Could
Mhm.
that be a layer? Could it
Mhm.
be a nutritional evaluation where there's some food sensitivity?
Yeah.
Be aware that there are numerous things that can contribute to sleep issues among people with FASD and in the general population.
Hmm.
So one of them is circadian misalignment. So really paying attention to what time we go to bed, what time we get up, how much we're napping during the day,
Hmm.
what's our sleep-wake schedule Monday through Friday, and is it way different on Friday night and Saturday night? I mean,
Yeah.
shift work, nighttime eating
Yeah.
behaviors, a million things. What kind of medications is the person on?
Yeah.
Certain medications can absolutely drive the bus with more
Hmm.
sleep issues. There's many cases I've consulted on where the person's been on 20 plus meds a day and also over the counter products and they're not eating healthy and
Hmm.
they're skipping meals, all
Hmm.
kinds of things. Medical factors have to be ruled out, psychiatric factors, social factors. And is the person dealing with like a primary sleep disorder in general, like an
Hmm.
untreated kind of sleep apnea kind of situation where maybe because of a broken nose or something's going on. So lots and lots of things. If you look at the screening literature in the neurodevelopmental disorder literature, this is not necessarily FASD specific, even though FASD is a neurodevelopmental disorder. I think this would apply easily to people with autism,
Yeah.
intellectual developmental disabilities, ADHD as well. And in that literature, it talks about what is going on really with that person's overall medical health. So,
Hmm.
ruling out asthma, it talks about substance misuse problems, drug and
Hmm.
alcohol problems absolutely co occur with sleep issues. Ruling out traumatic brain injury histories. There's a lot of cases I've consulted on where the person with FASD has also sustained some head traumas at various points in their life. And obesity
Hmm.
plays a role in this. In overweight status, it
Hmm.
talks about, and there's plenty of literature that talks about obesity and sleep issues oftentimes go hand in hand.
Well, I know it does with sleep apnea.
Yeah,
Yeah.
without a doubt.
The conversation that I had in the first part of the two-part episode is, where you said that fetal alcohol exposure can tee up sleep apnea. I had never really considered any other cause other than obesity.
All kinds of
So,
causes, all
yeah.
kinds. There was somebody I know who is healthy, normal weight, went to the dentist. The dentist said, looks like you might have sleep apnea. You should go get tested.
Mm-hmm.
What was found out, this person as a child sucked their thumb for so many years. The
Mm-hmm.
way their teeth and the bridge of their mouth formed, their airway wasn't getting in air properly at night. And this
Okay.
person was always tired, waking up every day, even though they
Yeah.
felt like they got a lot of sleep.
Yeah.
So sleep apnea can be caused by all kinds of things and sleep disordered breathing and things of that nature.
Mm-hmm.
So it's
Mm-hmm.
a real issue in the general population
Yeah.
as well. In the neurodevelopmental disorder research literature too, it says pay very particular attention to any environmental triggers or stressors. So everything I'm saying right now is screening, but
Mm-hmm.
screening is interventions. If you're not aware of this,
That's
then you
true.
can't make the changes. So
Yeah.
consider, okay, if you're listening to this and you have a child, a teenager with FASD, what's going on in your environment? Is there
Mm-hmm.
anything in your environment that could be contributing to this?
Mm-hmm.
Overcrowded household has been linked with more sleep issues.
Is that because the
Temperature,
noise level tends to be up?
absolutely. More
Okay.
people coming and going.
Yeah.
The,
So the busyness of it, as well as the
absolutely.
general noise level, or
Sure.
perhaps the higher likelihood of sharing a room, and therefore,
Yeah.
yeah,
Lack of
yeah.
privacy. Now,
Mm-hmm.
overcrowded houses don't equal dysfunction per se. It could in
Right.
some cases, but I know people with overcrowded houses, it's a loving, caring, stable home,
Mm-hmm.
but
Mm-hmm.
people are sharing bathrooms or go, 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 go. No one's sitting
Yeah.
down for meals. It's
Yeah.
stressful.
Yeah. So,
Temperature regulation issues is another thing in that household. Not having an air conditioning or it's too cold.
yeah. Yeah. I know my husband likes the environment a lot cooler um than I do. And like he's sleeping on top of the blankets and I'm under three.
So for some people, and this is not FASD specific, but it sure can be, HPA axis dysfunction, our
Mhm.
hormones are off, we might have temperature regulation issues.
Yeah.
There are people that you and I had to talk about this by phone last week, actually. You told me the story about people going outside with FASD in the heart of
Yeah.
winter in shorts or short sleeve and just not feeling that temperature. Can you share that? That was fascinating what you
Yeah.
shared.
So we have some feedback. Isn't that weird? I could hear myself echoing. Um, so I was questioning about interoception, right? The ability to feel what's going on inside our bodies. So, we frequently talk about the inability to know when you're hungry or to know when you're full, right? But there's also the ability to feel pain or not feel pain, right? That the variable pain tolerance, right? But also having that awareness of temperature. So, for instance, if you cannot feel the heat, then it's very dangerous in terms of it, you would fall, you'd be susceptible to heat stroke a lot more readily than the average person. Or contrary, if you cannot feel the cold, then the environment itself is not a trigger to say, dummy, go back inside and get your coat. Um, you know, I didn't figure out I had FASD until I was 56, but as a child, my mom had a job, and so I was the youngest of three. My brothers were 4.5 years older than me and 9 years older than me. So, they were there, but I would go off to school wearing nothing but a knit cape, when it's 20 some or 30 some degrees, and I'd be perfectly fine. Of course, I was expending a lot of energy because I had to walk a mile to get to school. But then in college one year, um, I didn't live on campus, who could afford campus housing. but I lived like, I don't know, probably 5 miles, six or 7 miles as the crow flies. But it was a bus route. But if the buses weren't, so I would take the bus. In the summertime, I'd ride a bike. But in the wintertime, I had of course, I lived a lot further north than I do now in Southern California. Um, my coat, my jacket, it was, probably hip length or upper thigh length, but it was sheepskin with the leather on the out, or suede on the outside, and the fur still attached, the fur on the inside. So it was an amazingly warm coat. Um, but on campus one day, a cold front came through, and they actually, the city shut down, and the campus, University of Pittsburgh, shut down. But there weren't cell phones, so there was no way of notifying the people that weren't living on campus. So I took the bus in like normal, and I was overheating. I had no idea how cold it was, and I'm wearing just a t-shirt with my jacket open, and I was still sweating. So it just, those were the kinds of things that I was thinking about as we had been talking about interoception.
Another variable to absolutely consider in this discussion that could accelerate sleep-related issues at night. Absolutely.
Mhm. And yet now I'm sleeping under 3 blankets when
Yeah.
the thermostat's set for, 65, 68.
And these things can change as we
It's
we get old. I mean, it
yeah,
doesn't stay the same always.
yeah,
So
yeah. I try. Weird things happen as you get older. Just saying.
in the neurodevelopmental disorder screening literature for sleep, it absolutely stresses the importance of really digging into nutritional history,
Mhm.
food sensitivities, digestive
Yeah.
health issues, even fluid consumption habits. There's a case
Mhm.
I consulted on. This was before COVID, and this person had a neurodevelopmental disorder, tons of sleep issues. Dug deeper, this person was drinking tons and tons of water right before bedtime, multiple
Mhm.
glasses. So they were waking up numerous times a
Yeah,
night.
because their kidneys kept working.
They did not connect the dots,
Yeah,
that abstract reasoning. So
yeah,
some coaching around that helped.
yeah.
It does stress the importance of taking into account caffeine,
Mhm.
sugar, and nicotine habits and histories.
Yeah.
Any one of those things can adversely impact sleep. And it
Mhm.
really stresses the importance of being aware of that person's social habits,
Yeah.
including do they get bullied and teased, and their emotional status, attachment problems,
Mhm.
how they handle stress, do they engage in self-injurious behavior, looking at any trauma history whatsoever, mental health issues. So
Mhm.
that's kind of what
Yeah.
the neurodevelopmental disorder literature says in a nutshell.
So you've brought smoking up at a couple different places between this conversation and in part one.
Yeah.
And I'm very curious about that. Um, my mom is a diehard smoker. I have tricked her with the wine. She doesn't know she's been sober for over 3 years. Like, I keep refilling those little 6-ounce bottles with alcohol removed Merlot wine. But I haven't figured out yet how to do that for the cigarettes. But she's 91. I'm not going to spend what little time she has left arguing about it. But I have this recurring conversation with my husband. He's like, I just don't get it. I tried it once. It was nasty. I just don't get it. As a former smoker, I do kind of get it because it was like a placebo kind of thing. If you need energy, it would give you that. If you needed to relax, it would do that too. Or so I thought. I'm I'm so thankful that, that's long behind me. But how does is it the nicotine, or is it the additives, or how does that work with sleep?
All the above. And
Okay.
I'm a certified tobacco prevention specialist through the Mayo Clinic. I actually have that credential, and I went
What don't you do?
the reason, honestly, the reason why I do that, because almost every client I've ever worked with smokes.
Really?
Yeah, so I wanted to really understand
Okay.
tobacco, and I was shocked to learn that tobacco use in and of itself can cause mental health issues.
Hmm.
I do a lot of work in the area of neurocriminology, and there's plenty of research that shows that prenatal exposure to tobacco
Mm.
and early exposure to tobacco may actually be a risk factor for future criminality in some cases. Again, there's all kinds of other
You,
variables.
I think I remember you mentioning that in the episode we did a long time ago on neurocriminology.
It's a fascinating
Yeah.
topic.
Yeah.
I have so much info. We could easily do a segment, and there's a lot of literature actually out there on prenatal alcohol and tobacco exposure together,
Hmm.
as well as
Hmm.
prenatal alcohol, opioids, and tobacco exposure. Because a lot of times it's not just the alcohol we're talking about in
Yeah.
utero.
Let's
Some
let's
cases it's
dig
cigarettes.
into that at some point, and then I will pitch it for, professionals to listen to in particular.
It may be a factor that contributes to drug and alcohol relapse as well that people don't
Hmm.
consider. And there's plenty of research that shows that smoking cigarettes impacts our gut microbiome. And if our gut microbiome is off, our whole
Everything
body's
else
off. Now our
is,
hormones are off. So
yeah,
that's just a few things how
yeah,
it can impact mood and energy and sleep,
and
just to name
sleep.
a few.
Hmm. Wow.
For sake of time, there's so many things I want to share, but I would encourage your audience to Google the 3P model of insomnia.
Okay,
This
I'm
is
gonna
not
have to write
FASD
this down.
specific. It's a really nice model that this doctor developed. It's called the 3P model of insomnia. And this model talks about what kind of factors are involved in causing, exacerbating, and just making people more vulnerable to insomnia. It talks
Hmm.
about bedtime habits, bed partner habits, biological factors, mental health, stress factors, all kinds of really good stuff. It's a really good model. If
Hmm.
you want to study insomnia, take a look. 3P model of insomnia.
Okay. Yeah, I'll see if I can find do you have a
You can just
favorite
find
link
different
there?
writings online and
Okay.
stuff about it, articles, things like that. But
Okay. I'll see
in
if
the
I can pull one or two and put into the show notes for everyone.
if any of you are working with families, or maybe you are a family that's living in poverty or homeless
Hmm.
situations, the very nature of being in those situations drives up the bus with sleep. Marital
Hmm.
dissatisfaction is a stressor and has been linked with more sleep issues.
Hmm.
Now, when we talk about treatment and intervention for sleep among people with FASD, complicated, without a doubt,
Hmm.
as you can imagine. There's biological factors at play, there's neurological, there's social, there's family factors, and the research says when treating sleep disorders in this population, it should be tailored
Hmm.
because a one size fits all approach doesn't work because everyone with FASD, again, different strengths, different limitations, different backgrounds.
Hmm. Hmm.
The intervention should be flexible, so you don't want to be very rigid with it in terms of you got to be flexible, adaptable, and look at what's working and what's not.
Okay.
Anytime we're talking about improving sleep in this population, trauma-informed care approaches is equally important.
Hmm.
And making sure the interventions you're teaching are developmentally and emotionally appropriate for the individual's kind of thinking. And a multidisciplinary approach is recommended because people with FASD, again, they might need the sensory, they might need a nutrition evaluation or whatever it is. There's not just one professional that can deal with this because of the vast array of medical,
Hmm.
social, psychiatric kinds of comorbidities this population deals with. When you want to focus on helping people with FASD get better sleep, it
Hmm.
also talks about really being aware of that in utero exposure to alcohol may have really kind of adversely impacted that person's biological systems in terms of hormone secretions and the HPA axis. So really taking into account hormones, neurotransmitters, and even blood sugar dysregulation is a factor to take into account. In the sleep literature in general, it talks about sleep hygiene practices, but in the FASD world, when we're talking about sleep hygiene, that's another term you really want to be aware of. Sleep hygiene are basically principles that can help people sleep better. Looking at their bedroom, their comfortability of their mattress, their pillow. Is there an animal in the bed with them and they're allergic to a dog and they don't even know it? What kind of lighting is coming in, the temperature of the room, even the dampness or the dryness of the room can impact sleep. So that when we talk about sleep hygiene practices for people with FASD, individually tailored, developmentally appropriate, taking into account primary and secondary disabilities, but also really considering their memory capabilities, because we spoke about that in the last segment, that memory issues could actually be a factor that gets in the way of this population getting good sleep. Medical comorbidities, again, very common, and the sensory considerations have to be taken into account. And one thing that we didn't really talk about, but we will now, is central nervous system dysfunction. Prenatal alcohol exposure causes central nervous system dysfunction amongst all kinds of things. And when we have central nervous system dysfunction, that contributes to all kinds of problems in the human body, including sleep issues. So in the central nervous system regulation literature,
Excuse me.
there's vast arrays of strategies that people can use. First of all, it talks about educate yourself about the central nervous system. First of all, what is it? What happens when it's damaged or not working properly? But the interventions it talks about to help calm the central nervous system. And if we can calm the nervous system, our bodies work better and we're more likely to feel relaxed and get better sleep. Building resilience, exercising, eating healthy, not just getting good sleep, but getting good rest as well.
Yeah. So I know, looking at the development of the fetus, right? The very earliest stages of the baby, the first two systems to come online, one is the gut and the other is the central nervous system, right?
The gut brain health axis, they work hand in hand.
Yeah. And that's the earliest of exposures before anyone could possibly know that they're pregnant will impact those two very primary, very foundational systems of our being.
Yes. And there's finally emerging research coming out that we've all known, but empirically now they're saying people with FASD might have more gut health issues. There's numerous studies in the autism literature. And I've been seeing it for years. Almost every client I've ever worked with who has FASD does complain about digestive health issues. It could be diarrhea, it could be constipation, it could be just extreme bloating, just extreme pain, irritable bowel syndrome, and the list goes on and on and on and stuff. Central nervous system strategies are really common sense, but it's a good reminder. Sleep is a great thing to calm the nervous system. Getting the gut better. Promoting connectiveness. Feeling more socially connected is an intervention for sleep and for our nervous system.
Okay.
Parents who are raising kids, learning about mindful parenting approaches has been linked with calming your child's central nervous system and helping them sleep better. Mindful parenting, trauma-informed parenting, attachment-informed parenting. Having technology detoxes, so getting technology out of the bedroom. Practicing self-compassion is actually an intervention that's been shown to help improve sleep in the general sleep literature. The question maybe is asked, how can self-compassion improve sleep? If we're nicer to ourselves, We can forgive ourselves when we
Yeah.
screw up.
Yeah.
Self-compassion has been linked with reducing stress.
Mm-hmm.
It can improve resilience. It helps foster positive thinking. When you're thinking more
Yeah.
positively and you're more grateful, optimistic, you have gratitude, how do you feel compared to if you are stewing and you're ruminating
Yeah.
and you have all this anger and you want to get back at the person? We know which one is better for the body, which one
Mm-hmm.
drives inflammation, which one calms down the system. Self-compassion has also been linked with improved ability to self-soothe. And in the first segment, we talked about people with FASD oftentimes have a reduced ability to self-soothe and calm themselves when they become emotionally dysregulated. Breathing is another one. Deep breathing can be very helpful because deep breathing, if done properly and do it with a trained professional, can help activate our parasympathetic nervous system, which is the rest and digest component.
You know, and I couldn't help but think, as you were saying that, I mean, they've been saying it for decades and decades, even from when I was a little girl. If you're having trouble sleeping, then count sheep, right? Just imagine the sheep jumping over the fence, right? We've all seen the cartoons about that, but that is a form of mindfulness that will, you know, get that parasympathetic system going and get us calmed down and,
Yes.
you know, kind of almost self-hypnosis, right?
Yes, and think about this. We've talked about these subtopics. Deep breathing has been linked with improved digestive health functioning.
Mm-hmm.
And if you're working with someone with a chronic pain disorder, deep breathing may actually bring down their body pain at least a little bit.
Yeah.
And have you ever dealt with daytime fatigue? Try deep breathing for a few minutes. That actually has been linked with increasing our energy during the
Okay.
day. So
Yeah.
deep breathing, another practical strategy. Again, talk to healthcare providers before doing this. In the sleep literature in general, it talks about music interventions.
Mm.
I'm not talking about jamming to some hardcore rock music right before bedtime. Well, I'm not against rock music, but maybe during the day. But anything that calms our body and
Mm-hmm.
brain,
Mm-hmm.
maybe it's soft, soothing music, that
Yeah.
actually calms our nervous system.
Yeah, and but it also works to help with focus,
Yes,
right?
it
I
does.
I remember back when I was in doing my undergrad back in the mid 80s. um, I had season tickets to the symphony, and you know it was a Sunday matinee because it was cheap, right? But I would take the bus down to the symphony hall with an idea in my head about a paper I needed to write. And by the time I got back to campus, I just had to type it up. It was all written in my mind by the time, just from listening to that classical music.
Absolutely. I love classical music, and
Yeah.
I've heard some amazing stories when people listen to classical music.
Mm-hmm.
So,
Yeah.
yes, definitely. And there's no side effects to that. I mean, maybe someone doesn't like it, but they're not probably going to have a huge adverse
Yeah.
reaction. So, trying some new things.
Yeah. Yeah.
Other sleep hygiene practices that any of us can use, regardless of diagnosis or not, the more we can learn about self-soothing skills, anything we
Mm-hmm.
can do to promote self-soothing.
Yeah.
Most people do well with a quiet, dark room environment to get best sleep, but
Mm-hmm.
the caveat to that is if you're working with trauma survivors, the dark again could be a trigger. So
Yeah.
that's why individualizing this and having a trauma-informed mindset is
Mm-hmm.
important.
Yeah.
Most people do well when the room's a little cooler than when it's really hot. The
Yeah, because you
research
can always add more layers. But
absolutely,
once you're a sweaty pud ball at night, good luck getting
yes,
back to sleep.
absolutely, absolutely. Take a look at just look at your room. Do a 360
Mm-hmm.
scan.
Mm-hmm.
Is it a stimulating environment visually? Look at the pictures on the walls. Are there bright colors? What kind of
Yeah.
sheets or blankets around there? Is it really overstimulating to that individual, which could be a sensory trigger?
And that's interesting because one of the interventions that I often suggest, I learned this at Facets when I was getting certified, is to go into, your room or your child's room, whoever it is that has the FASD, go in 5 separate times because we have 5 sensory systems that give us information about the environment, right? And take a pad of paper and a pen, and the first time in, write down everything that you see in the environment, to your point that you just mentioned. Is there a crap ton of stuff on the walls, or are the flat surfaces in your room covered with everything? How busy is it? Is it what are the colors? And the whole psychology of color is fascinating. And
Yeah.
then write it all down, leave the room, clear yourself again, go back in. And what are all the things that you hear? But be really
Great strategy.
still, be very still, and let your hearing become super sensitive. And what do you hear? Can you hear someone, like if it's an apartment complex, can you hear someone above you, below you in the next units? Or do you live by train tracks, or a fire station, that kind of thing. What are the things that you hear? And then again, write it all down, go out, clear your own senses, come back in. What are the things that you smell? Right?
Excellent tip.
What are all the different textures that you can pick up with your fingertips or your bare feet? Right? Um, and then, so that's, what am I leaving out? Smell. So, so do that with all 5 of the sensors that you give us information about the outside, and then compare all that with what you or your child is sensitive to. And because
One
that's
child with FASD could be very sensitive to that picture on the wall. The next child with FASD wouldn't bother them at all. So
right. Right.
trial and error.
Yeah.
And you mentioned something too about the train tracks. I actually talk about noise annoyance in some of my trainings.
Hmm.
So really pay attention to the noise,
Yeah.
externally and internal noise. Internal noise could be that person just they can't quiet their thinking. Just
Yeah.
they ruminate, they stew on things.
And I think too, it's what are you acclimated to? What is normal, right? Because if you take someone from the country and you give them a downtown apartment where you have the fire halls and the police sirens and this, that, and the other thing, they have a lot of struggle with sleep. Conversely, if you take a inner city dweller and you stick them out in the country, it's so quiet that they can't handle it, right?
It'll take some time to adjust. It
Yeah.
will take some time.
Yeah.
Some other strategies that I pulled from the ADHD literature, which can be very applicable to the FASD
Mhm.
world, and this is applicable to all populations, consistent bedtime routines, Monday through Sunday.
Yeah.
Same time going to bed, same time getting up, it's recommended.
Yeah.
Napping's a tricky thing. I'm often asked, should I take a nap? Well, I've worked with people who take hour-long naps every day. That's probably a little much.
Mm.
Taking a 20-minute nap, probably not the worst thing, but talk to your doctor, of course. Really paying attention to the environment in the ADHD literature it talks about. So maybe it's getting those dimmers on the
Mhm.
lights and paying
Mhm.
attention to the temperature,
Yeah.
avoiding heavy meals before bedtime, that research says. Why should you avoid heavy meals before bedtime? Because heavy meals spike your blood sugars and
Mhm.
then crashes it.
Yeah.
Both can be very bad for sleep.
Yeah.
Again, I'm not giving
Yeah. And there's
nutritional advice here,
and
but
there's a little bit of a delay too.
oh,
If
absolutely.
it's a high, if the carbs are not complex, if they're simple sugars, then you have the
Absolutely.
absolute spike. Um, Complex carbs have a little bit slower of a fall. Um, Fat content does the same thing. Um, fat will also very quickly convert over to high blood sugar levels. Um, like my number one go-to fix if I'm out and about and my sugar crashes, I go for French fries
Oh dear.
because it's both carbohydrate and high on the glycemic index and also the fat, and they will pull me up like that.
Good to
Um,
know.
but I can't just leave it like that because then I'm going to go down just as fast. So, but
Other
yeah.
thing, common sense things we know about, but too much caffeine, too
Hmm.
much sugar before bed, and caffeine, depending on what study you look at, has a half-life of many, many hours. So
Hmm.
be aware of that.
Yeah.
Try to avoid any stressful activities right before bed.
Hmm.
If you have to do stressful activities as much as possible, do them earlier in the day. It does talk about in the ADHD literature, get off the screen at least 2 hours before bedtime. If you can't
Hmm.
do that, start with a half hour, do what you
Yeah.
can.
Yeah.
It does talk about movement during the day. So
Hmm.
getting outside in nature has been shown to be very, very helpful.
Yeah.
And
You know,
in the FASD, or go ahead.
I was just thinking about, a year ago when I decided to open my business, I actually um, took a training, a very year-long, very in-depth training on becoming a coach, because my academic career was never licensure driven. I'd always been able to work without one. So I wanted to say, okay, well, what about this coaching bit, right? And the one instructor was talking about how we have these natural rhythms where every 2 hours we need to break, and whether it's actually physically getting a cat nap in, a 10-minute, or just doing something else to completely shut down the mind and refocus, and then come back to it for another, supercharged creative chunk of time. But he's like chunking it all day long in these little mini cycles as
Giving
a
the
way
brain
of
break. Yes.
ramping up productivity that way. It's just kind of fascinating stuff.
For me personally, if I do too much thinking before bed, not good at all.
Yeah.
So for me, I try to stop doing a lot of thinking, like strategizing, grading
Mm.
papers, and even closing my eyes and getting the screen off and just laying
Yeah.
there, even for a little while. I sleep better. I
Yeah.
absolutely do for myself.
Yeah.
And the exercise, for me personally too, and the research supports this, if you do rigorous exercise right before bed, that
Hmm.
can be a really tricky thing to get good sleep.
Yeah.
Doing rigorous exercise earlier in the day, probably better. But again, if you're
Yeah.
doing any exercise, make sure you're okay
Yeah.
physically to do this as well.
Yeah. Yeah, for sure. Yeah, I was never one of those people that liked doing a workout in the evening, you know, because it kept me from being able to fall asleep for quite a long while afterward. And I love my sleep.
This is a caveat to that. The exercise that I do in the evening is if it's a light walk or
Hmm.
even doing yoga or deep stretching, that does
I was
not,
going to say stretching. Yeah.
yeah, that does not impact my sleep for me personally, but
Yeah.
everyone's different, of course. But
Yeah.
I know we're running close on time. Another
Yes.
another huge thing to think about, and this might be good for people with FASD, it might not be, but it has to be tailored if it's going to be used with FASD, is cognitive behavioral therapy for
Hmm.
insomnia.
Oh,
CBTI is an evidence-based practice. It's the
okay.
gold standard for treatment for insomnia. It is a non-pharmacological approach to the treatment of insomnia. And the research shows that CBTI, cognitive behavioral therapy for insomnia, might be just as effective as medications for insomnia. Now, in the FASD world, don't know, but this has been studied with all kinds of populations. And if you don't have a lot of training in CBTI, it's a behavioral method used to
Hmm.
treat sleep problems. It's a structured program,
Hmm.
tons of evidence around this. So it's evidence-based, it's highly
Okay.
effective, it's solution-focused, and the components of CBTI is cognitive therapy.
Hmm.
relaxation therapy, sleep hygiene education, which we talked about today,
Mhm.
sleep restriction therapy, and stimulus control therapy. We have not talked about all of those. We don't have time
Yeah.
today, but
And I'm curious too, because oh, that thought just kind of disappeared again. It whizzed by too quickly.
happens to the best of us.
And it was brilliant too.
Well, don't leave us
Momentary
hanging
flash,
if you think about it. Put it out on
right?
Facebook, please.
Oh, momentary flash of brilliance. Emphasis on the momentary. Oh my
So
goodness.
hopefully your audience walks away knowing there's all kinds of things we can
Yeah,
do to get it better. But just know we're all,
I have it.
and I see that you might have something to
I
share here.
have it. We were not episode, the first half of this two-parter, but the previous one, we talked about how if someone uses insight-based therapy, it can create issues with um, suggestibility and um, false memory, that kind of thing, confabulation. And, just saying if they're well-intended therapists can be
Well, might not be so
creating,
much insight-based therapeutic approaches, but it could be more suggestive therapeutic approaches.
yeah. So I
Yeah.
wanted you to tease that out, if you could, very briefly. CBTI versus because insight-based therapy is very cognitive. So can you flesh that out a little bit quickly, given your time
Yeah,
constraints?
so insight-based therapeutic approaches often don't work for people with FASD because of the abstract reasoning
Yeah.
deficits, because people who go to therapy for insight-based therapeutic approaches have to have good self-awareness. They have to
Hmm.
connect the dots, see the
Yeah.
forest through the trees.
Yeah.
And people with FASD struggle with that. And if they go to treatment as usual, and they don't take into account their brain-based capacities, a lot of times these
Hmm.
treatment as usual programs don't work. They do best with concrete instructions, role playing,
Yeah.
psychiatric rehabilitative approaches, coaching, modeling, teaching. If you're going to use CBTI, if you're a therapist, someone who does this work, get training in it, of course, but
Hmm.
you got to get training in FASD and you got to be able to
Yeah.
tailor the approach, because if you're
Okay.
asking that person a ton of how and why questions, you may not get good, accurate responses. You've
Yeah.
got to fact
Yeah.
check, you got to verify, and if
Okay.
possible, work with the caregivers too, because whatever
Yeah.
you're teaching that person with FASD, if that caregiver or the people they live with are not reinforcing that and they're
Hmm.
saying something totally different, that's
Yeah.
crazy making for people
Yeah.
with FASD.
Yeah. Absolutely. The other thing that when we started this half of the episode, you were talking about all the different assessments that are helpful and beneficial in arriving at the specific causes of sleep issues for any individual. And that's, you're talking about a very holistic approach, right? Looking at the whole body, treating the entire person. But our medical system seems to be more and more splintered as time goes on. So, any thoughts on that? How we can successfully advocate for this, that, and the other specialty appointments?
There's no other way in my mind to go about this than a holistic multidisciplinary approach. This is just my
Mm-hmm.
opinion. Western medicine as a whole treats the symptom.
Mm-hmm.
Functional medicine, functional nutrition wants to get to the root cause.
Okay.
And what we talked about today, look at all the potential contributors to sleep
Mm-hmm.
issues.
Yeah.
It's
Yeah.
not just one thing, it's a multitude of factors. So if we were to have a holistic approach to this, you're working with your healthcare providers, but you're also maybe working with sensory processing specialists.
Mm-hmm.
You're working with nutritionists. Maybe it's an in-home sleep coach.
Yeah.
So it's
I'm
multiple
just
people.
yeah, I'm just curious about the accessibility of that for most of the folks, right?
If you do a general Google search, sleep specialist for FASD, a frown will come on your face quickly that you're just not going to find much.
Yeah.
It's tough, but you will
Yeah.
find more for people with autism, ADHD, and you'll find coaches out there online
Mm-hmm.
that provide coaches and tips and strategies. But your standard sleep coach, most of the time, has never had training in FASD. And a lot of
Mm-hmm.
these sleep coaches, in my experience, don't have training in trauma and attachment and
Yeah.
executive function. So if you are going to find a sleep coach, try to find people that know these other layers here too,
Mm-hmm.
or if they don't, being willing to collaborate with other providers or learn
Yeah.
how to tweak their standard sleep practice
Yeah.
protocols, because sleep hygiene practices are wonderful, but they need to be
Mm-hmm.
tailored for someone with an FASD kind of
Mm-hmm.
background
Mm-hmm.
and some of the challenges that the diagnosis carries.
Yeah. Yeah. Now, Jerrod, you have, oh, again, as usual, flooded us with so much information. I would be most grateful if you can think of 1, 2, or 3 articles that I can put the link to in the show notes for people to explore further.
Of course.
Um, because this is such an important topic, and it's so much broader than I would have ever thought. And I'm sure that's, probably a universal response to everything that we've been able to learn through you. Um, so I think that would be tremendous if I can put that information in. But I just thank you so much for your time.
You're welcome.
I know we chatted longer than we generally do, and I'm just very grateful for your suggestion of making this a two-parter. Yeah, and I still feel like we could probably go on and on and on ad nauseum a little bit, you know. Um, so again, huge, and I'm just so honored that you keep coming back to living
Well,
with FASD.
thank you for having me, and I will send you some links to
Okay,
some articles on the very topic.
yeah. Oh, everybody, I can't imagine, that our time has been wrapping up again so quickly. Thank you for coming back for not just 1, but 2 episodes this week. And, come back again to the YouTube channel on Friday for another free Friday tidbit on the neurobehavioral model. In December, we're kind of wrapping things up for these mini 5 or 10-minute teachings on the neurobehavioral model. Um, and then come back again next Monday for another episode of Living with FASD. If you like what you've heard today and in both of these episodes, please drop me a line at livingwithfasdpodcast@gmail.com. Let me know what you most appreciated. Let me know what other questions you may have, and maybe I'll be able to get that answer for you. Hop on over to Facebook, to the Living with FASD podcast group, and join the community, and you can interact with each other and just have some good fun around the podcast and all the different things that we talk about. And then if you have not already, you can pick up my book, Sip by Sip, Candid Conversations with people diagnosed as adults with fetal alcohol spectrum disorder, because as I keep saying, the diagnostic rate for FASD is so abysmally low. I didn't find out till I was 56, and many of the people that I talked to for the book found out in their 40s, 50s, and 60s. So a lot of us are living life without understanding why things are so hard. And maybe within the pages, you or someone that may find some answers and some direction, some ideas on what they can, consider for getting some clarity for their life. Anyway, come back again And thank you for tuning in this week for Living with FASD. Jerrod, my friend, it is once again an honor and a pleasure to have you on the episode.
Thank you. And thank you for all the great work you're doing. And thanks for having me back.
All right.